Today I would like to explain about one very important disease condition which is present in the respiratory system. Before going to the topic, I would like to explain what is the anatomy and physiology of respiratory system. The anatomy of respiratory system, it has consist of an upper respiratory tract and lower respiratory tract. First one is the upper respiratory tract. It is starting from the nasal cavity, pharynx and larynx. So these are the main three organs or comes under the upper respiratory tract. The second one is lower respiratory tract. It has trachea, primary bronchi and lungs. Okay, so these are the lower parts or comes under lower respiratory tract. So this is the two dividing parts of upper and lower respiratory tract. In our respiratory system, we have two important portions. First one, conducting portion or transporting air into the lung. It is include the nose, nasal cavity, pharynx, larynx, trachea, and progressively smaller airways from the primarily bronchi to the terminal bronchioles. Okay, so it means from the external to transport the air into the lungs. So that is called as conducting portion of the lung. The next one, respiratory portion, that means carries out gas to exchange, composed of smaller airways called respiratory bronchioles and alveolar duct, as well as sacs called alveoli. Okay, so this is a portion of respiratory portion. So this is the two main important portion which is present in the respiratory system. Yeah, friends, today our topic is termed as wheezing, which is present in the respiratory system, and also it is very important disease condition in respiratory system. If you are ready, let's get into the topic. Definition of wheezing: respiratory system which is comprised lung parenchyma and compliant airways, flow limitation and excessive resistant induce flutter of the airway wall, which is making a high pitched sound which is known as wheezing. So this is the definition of wheezing. Wheezing, that means actually our respiratory system, it has the lung parenchyma and airways. When it is getting irritation, that time it will make a abnormal high pitched sound known as wheezing. Wheezing is simply termed as obstructive respiratory disease, and the wheezing is most important cause of the infant is bronchitis, and asthma is the most important cause of the wheezing who children and adult. We have a two pattern of wheezing. The first one, transient early wheezing. Transient early wheezing, that means due to the smaller airways, it may induce the wheezing. Then inducing of viral infection. So this is about transient early wheezing. The second one, persistent and recurrent wheezing. It may the presence of IgE in the blood and to inducing of the allergens like house dust and pollens. So this is the two pattern of wheezing. First one, transient early wheezing. It may the causes of smaller airways. Second one, persistent and recurrent wheezing. It may inducing of the allergens like house dust and pollens. So this is the two pattern of wheezing. Next, causes of wheezing. First one, viral infection. This viral infection may be due to the previous endotracheal intubation, previous admission into the hospital, or choking and aspiration. So these are the causes may lead into the viral infection. Once baby is getting a viral infection, it will lead bronchiolitis. Bronchiolitis, that means it is an inflammation or infection into the bronchioles. Okay, so due to the infection, the bronchioles will get the hyper secretions. This hyper secretions will obstruct the airway. It will lead into the wheezing. Next one, atopy or exercise and smoke. Atopy, that means due to the genetic causes. Then excessive exercise and smoke. So these are all the causes for wheezing. This atopy, exercise and smoke, it will lead into the bronchospasm. Bronchospasm means it is a abnormal contraction of the bronchus. So due to the abnormal contraction, the bronchus will get obstruction. So it may lead into the wheezing. So this is the causes of wheezing. Next, pathophysiology of wheezing. First one, triggering factor. This triggering factor may be the viral infection or genetic causes. So it will trigger the respiratory tract. So due to the triggering factor, the airway will get inflammation. This airway inflammation will stimulate the hypersecretions of mucus due to the infection or inflammation. Otherwise, it will to constrict the muscles like a bronchospasm. Then swelling bronchial membranes. Swelling bronchial membranes due to the infection or inflammation. Then it will lead into the narrow breathing passages, hypersecretions, airway muscle constriction and swelling bronchial membranes. It will lead into the narrow breathing passage. That means the asymmetrical shape of the breathing passage. It will lead into the wheezing, cough, shortness of breath and tightness in chest. Okay, so this is the pathophysiology of wheezing. First one, the triggering factor will stimulate the airway inflammation. The airway inflammation will to stimulate the hypersecretions of mucus and the constriction of the airway and filling up the bronchial membrane. It will to narrowing the breathing passage. Finally, it will lead to the wheezing. Next, the clinical features of wheezing. First one, fever. Whenever our body get any infection or inflammation, the first signs and symptoms will be fever. The next one, level of consciousness. Because of the lack of oxygen supply to the brain will get tiredness. The baby level of consciousness will be decreased. The next one, weight loss. The next one, exhaustion. Exhaustion, that means feeling of over tiredness. The baby will feel like a fatigue. Then next one, apnea. Apnea, that means very minimal level of breathing. The next one, hepatomegaly. Hepatomegaly, that means the enlargement of the liver. Cyanosis. Cyanosis due to the lack of blood supply to a part of the body. Next one, degrees O2 saturation. The normal O2 saturation is above 90. During this wheezing, the baby will get the degrees O2 saturation. The next one, breathing. The baby will get too much of breathing difficulty. Then heart. The heart rate will be high, more than 160. Okay, so these are the main clinical features of wheezing: fever, decreased level of consciousness, weight loss, exhaustion, apnea, cyanosis, decreased O2 saturation, hepatomegaly, and increased heart rate. The next one is diagnostic evaluation of wheezing. First one, history collection. To collect the thorough history into the parents regarding any previous admission into the hospital, choking or aspiration or previous intubation. Okay, so this is a thorough history to collect the parents. And one more thing to regarding genetic disorder. Okay, the next diagnostic evaluation is physical examination. During this physical examination, we can find out to the asymmetrical expansion into the chest wall, then increased respiratory rate and increased heart rate. Okay, whenever the baby is getting wheezing, we can find out the increased heart rate and increased respiratory rate. And through the inspection, we can find out the asymmetrical expansion of the chest wall. Okay, the next diagnostic evaluation is blood test. During this blood test, we can find out the infective values. Then chest x-ray. So these are the main investigations for wheezing. Last one, treatment of wheezing. The first point, infants with acute bronchiolitis who are experiencing respiratory distress should be hospitalized. Okay, Whenever the baby is getting any respiratory infection or wheezing, they supposed to be admitted into the hospital. The next one, mainstay of treatment is supportive, like as per the symptomatic we can give the treatment, like positioning is very important in wheezing, then to give a warm water and to administer the IV antibiotics. Next one, if hypoxemic, the child should be receive a cool humidified oxygen administration of the baby. The next one, the infant may be feed through a nasogastric tube. Oral feed may be induce the vomiting and breathing difficulty. So we can suggest the nasogastric tube feeding. The last one, frequent suctioning of nasal and oral secretions. If the baby has so much of secretions, means we can suck out the secretions. Okay, so this is the treatment of wheezing.